It's always a rule that before you engage in any sports, you should know your health status. Because what happens, at times you go in sports, you are energetic, you're young, then you end up getting more injuries. So people need to be supervised and trained by trainers who are certified and trained. After finishing my master's program, I did an extra 1 year and did a super specialty in sports orthopedics. Now, returning back home, we had a couple of sportsmen. I'll give an example. A gentleman who is very popular, he's called Rwanda. He was also playing in the national team. He had had an injury for a couple of years, anterior cruciate ligament injury. And we did his surgery. It was very successful. And from that time, all those patients who used to be referred, particularly like in Morocco, there used to be a FIFA clinic. It stopped. We started doing them here in Rwanda. And that doesn't only apply to sports injury. Even like our colleagues in the military, when they're doing military drills, they get lots of injuries. They also get the same services, even the police, you know. So the trend has changed. At least in the National Referral Board, we no longer refer patients abroad for such injuries. It's all being managed locally.
I'm Nanyondo Rebecca, and I'm from Kampala, Uganda. I came here for the orthopedic service. I got a painful wrist since childhood. I never got an accident, but I had visited very many hospitals around Kampala, Uganda, but I failed to get the best treatment for my hand. So I was advised to come to Kigali Specialized Orthopaedic Hospital for the treatment. The procedure was done successfully, and I'm so happy for the doc and the whole hospital team.
Medicine is a calling. It's a calling whereby you have to come in and be ready to serve the people, serve the population. So, and it's promising. It's getting better day by day with improved technology, with AI. You know, it's getting better, and the beauty about it, our government is very supportive. At the same time, they are looking into new innovations. I'm called Dr. Emmanuel Bukara. I'm a senior consultant orthopedic surgeon. I worked briefly as a general practitioner, but I was motivated and mentored by Professor Alex Butera, who is also a chief consultant in orthopedic surgery. And he motivated me to do orthopedics. In fact, that's when I joined South Africa to train in orthopedics. And what motivated me to do sports orthopedics? I remember in 2012, I was in a park outside walking. My family had come for holiday. Then I met a couple, and they said they were from Rwanda. The husband had crutches. I asked him, what's the issue? He said he had had surgery, and that surgery was done in India. It was a knee arthroscopy. Honestly, my heart, I'm like, no, can't go on like this. That's when I decided to have a training in sports orthopedics. Say, I need to deliver these services back at home. So on top of, after finishing my master's program, I did an extra 1 year and did a super specialty in sports orthopedics. Now, returning back home, we had a couple of sportsmen. I'll give an example. A gentleman who is very popular, he's called Rwanda. He was also playing in the national team. He had had an injury for a couple of years, anterior cruciate ligament injury. And we did his surgery. It was very successful. And from that time, all those patients who used to be referred, particularly like in Morocco, there used to be a FIFA clinic. It stopped. We started doing them here in Rwanda. And that doesn't only apply to sports injury. Even like our colleagues in the military, when they're doing military drills, they get lots of injuries. they also get the same services. Even the police, anyone who gets associated kind of sports injuries or during the military, they get the same treatment. So the trend has changed. At least in the National Referral Board, we no longer refer patients abroad for such injuries. It's all being managed locally. Before, we never used to do minimally invasive surgeries in the area of orthopedics. That's dealing with joints where you have to do surgeries without opening. We virtually use a camera through pinhole, and in the area of orthopedics, that's when we started it around 2013, and from that time we've had lots of patients who have been handled within the country. Previously, they used to be transferred abroad. So the challenges are, one, because we do import most of the consumables and implants we use, the cost is quite high. Of course, that applies to any other African country, because it's something that it's quite expensive. It's implant-driven, pharmaceutical-driven, so the cost tends to be higher. But we hope with the engagement of multiple companies coming in and maybe having local plants manufacturing some of these consumables, it may ease off the cost as far as that is concerned. But also we've had lots of support, particularly from the insurances. At least all these procedures which are done are covered by insurances. Currently in the country, or before we established this hospital, there's no specialized orthopedic hospital, gazetted only purely for orthopedics. So, and I think it's being also encouraged from the ministry, at the level of the ministry, because the current trend is they prefer more specialized hospitals, where you come in, you get all the services you need. For example, our hospital will have, it won't only be sports orthopedics. We'll have arthroplasty, managing patients who have joint conditions, spine orthopedics, commonly severe back pains, then tumor and sepsis. Cancer is spread everywhere, so we tend also to have bones that get affected by cancers. Then also even pediatric orthopedic condition. So virtually, it will be more of a specialized hospital, but which is also super specialized. We have colleagues who have had specialized training. For example, we have a colleague who's more interested and also has a fellowship in foot and ankle. We have colleagues who are more interested in hand surgery. We have colleagues who would be working on spine patients. So it will be more of a super specialized hospital, but in the area of orthopedics. And that's what we've been lacking. Yes, because we find other hospitals, they have a small section of orthopedics, which is combined under general surgery department. So basically patients, once they've had injuries, they tend to lose muscle strength and muscle bulk. So what happens, even after surgery itself, it does affect on the muscle power. So after surgery, normal patients are referred here for rehabilitation and strengthening of the muscles so that they get back to functionality as it was before. And this applies also for spine, for pediatrics and other disciplines. So those patients who have recovered, they tend to come this side so that they tend to do a normal exercise like anybody else. So one of the things that tend to challenge patients, for example, after surgery, is using of stairs. We train them on how to use stairs because that's the biggest part of challenging. Then we also use these walk rails, which are used by patients, again, to be trained on how to do gait training, how to walk. Yes. And part also we tend to use the cycle. This hospital, we virtually have spent so far around 2 months since it's open, and we've received a couple of patients in the area of orthopedics, and the whole things are going, it's very promising, and the community and the population generally, Kigali, even the country at large, they're happy about the services. Because you come in specifically knowing that you're going to be attended to, with your issues of bone issues. And that also helps in the referral system. Being a specialized hospital, it's very easy for other colleagues from neighboring hospitals to be able to transfer patients here.
Okay, I'm Nanyondo Rebecca, and I'm from Kampala, Uganda. I came here for the orthopedic service. I got a painful wrist since childhood. I never got an accident, but I had visited very many hospitals around Kampala, Uganda, but I failed to get the best treatment for my hand. So I was advised to come to Kigali Specialized Orthopaedic Hospital for the treatment. And the doctor saw me, advised me to get a procedure. The procedure was done successfully, and I'm so happy for the doc and the whole hospital team. The procedure was successful as I talk. I went through the operation very well. I was cared by the best caretakers, the best doctors, and all I know is I'm getting better. The moment I reached here, I popped in, I got the best services, x-rays in time, everything was in time. I was handled very well, and I'm very excited. I was in my country, but I couldn't even afford the bills of the hospitals. But when I reached here, the bills are so friendly, and the team is working very well. So I'm so happy. Kigali Specialized Orthopaedic Clinic has really helped me.
If a patient has any emergency, they just call, they press on the button next to the bed, and the nurse can easily pick from here. It's a nursing call system. This is admission. We've got here around, it's a common ward. It's a 20-bed capacity hospital. So being an orthopedic hospital, this is a specialized bed for orthopedic patients, where we can do tractions, we can do elevation and everything. And we made sure that on every bed there's a patient, whatever overhead bed. As I said before, this is a nursing call system. So patient just presses here, and the nurse can know what's happening that side, and he rushes in. So on every bed we have an overhead cabin, overhead table, and there's also an attendant bed or chair. This can be transformed into a chair. Yeah. So that we make sure our patients, the attendants don't struggle with that. We have other colleagues who are more specialized in other subunits of orthopedics. For example, we have spine surgeons dealing with spine. We have foot and ankle specialists dealing with foot and ankle conditions. Pediatric orthopedics. We have myself, and other colleagues are also interested in sports orthopedics. So it's a whole package which is complete. And on the other hand, also we've had also very good support from the government, which does facilitate us as we establish the health sector, particularly with importing equipment. The system has improved quite remarkably in a way that we get even colleagues, orthopedic surgeons, being referred to even provincial hospitals. So it's no longer a process whereby patients being referred, for example, from Musanze to Shashka to be managed. They can be managed anywhere in the country. Medicine is a calling. It's a calling whereby you have to come in and be ready to serve the people, serve the population. So, and it's promising. It's getting better day by day with improved technology, with AI. It's getting better. And the beauty about it, our government is very supportive. At the same time, they are looking into new innovations. Being an specialized orthopedic hospital, and particularly with more interest in sports orthopedics, we do what we call minimum invasive surgery. So this is an arthroscopic tower. So virtually what happens, you operate from there, you don't open, and all you're doing, you're watching from the screen. So you're being guided by what you see from the screen, then you take it from there. So for example, this is a hand. You can really see this is my hand, the palm showing. So as we focus, it pulls it out and shows the whole hand and the fingers. Yeah, you can really see. Or I put out here, it's at least one of the latest 4K. Yeah, and also partly We tend to use this machine, which is called a SIAM. It's a very handy machine, whereby, for example, if you have fracture femur, you don't want to open, it guides you. It's an X-ray machine. You use it to take pictures as you see, if the nail that you put in is appropriate length, if the screws you've used are also appropriate sizes. So for example, like now we have a training center for minimum invasive surgeries. It's called IRCAD in Masaka, which is the only training center existing in Africa. Each continent has one. So IRCAD, which is here in Masaka, and that's a very good opportunity, particularly for young doctors, to learn more on minimum invasive surgeries where you don't need to open, use virtually camera, even robotic surgery.
Some people's pains are due to, whether it's due to trauma or cancer, whatever causes you can elaborate. But some people again have this pain carrying on that they need maybe other interventions. And most times you find if it's sports injuries, they need surgical interventions. However, in pain medicine, there are other options that you can explore for people who are probably not fit or they don't want surgical options and where their medical management has failed. So we bridge it with what we call interventional pain management, where we use minimalistic invasive procedures using precision guided instruments like ultrasound machines or X-rays, what we call fluoroscopy, and we guide needles to the right place where we have pain generators and we treat the pain at the site. People have been doing pain management. Sometimes they do it with blind techniques, what we call blind techniques. They will just go in using the normal anatomy and try to figure out, because you know where the anatomy is and you try to go in with an injection, but you can't see where it's going. This is a place with lots of blood vessels, with lots of other structures that you could injure. So usually it is a step higher if you use guided precision to place your needle at the right place at your target site without injuring other organs. So that is pretty much the difference with interventional pain. You're trying to use advanced techniques and equipment to target, to get precision injections to where you want them, not just using blind techniques. Yeah, some people have had like a limb that has been amputated, but there's what they call phantom limb pain. They continue having pain even after what would have alleviated that pain has been done. So these are the patients that fit the criteria for interventional pain management. Okay, usually so it's a multidisciplinary team. Chronic pain management is not a standalone service that you can do. Usually it's a multidisciplinary. That's why our team here, I'm partnering with orthopedic surgeons. Pain management is usually not at the forefront of managing people's pains. They will try to do all other, but once your doctor knows exactly what the problem is, and then you can get around it. So whether it's surgical management or medical, or there's an intervention we can do for you to alleviate the pain.
It's always a rule that before you engage in any sports, you should know your health status. Then what we still lack is thorough training of the instructors. The instructors need to undergo a training, or they need to be certified in a way that there should be some bodies to regulate. They should be certified and registered, and they must have had training, not just being trained on job. Because what happens, at times you go in sports, you are energetic, you're young, then you end up getting more injuries. So people need to be supervised and trained by trainers who are certified and trained. For example, basketball courts are being built everywhere, although we still have some gaps, but it's getting much better. Because one of the things that tends to cause lots of injuries is playing from rugged, courts or playgrounds, which tends to cause more injuries. So other than that, I think we're on the right track. So when we talk about sports injuries, We look at those injuries which are associated with sports. But also, it could also be like a road traffic accident. For example, you've been on a motor and you fall, injure your knee. You get your ligaments torn or menisci. All those are put in a category of sports injuries. Most of the time they manage without opening. We use it's done arthroscopically.